As far as inspiration goes, I think back to an article that I read many, many years ago when I first started working here about Mother Teresa. And the reporter asked her how she was able to deal with the sick and dying and keep doing it day after day after day. And her response was that she tried to see the face of God in every person she encountered. And that struck me at the time because that was not my way of doing things, of seeing things. And it stuck with me over the years and kind of inspired me to try to think more that way.
It's not really a who or what, it's trying to make a difference. I come to work every night to try to make a difference in what I do and just make a difference of helping other people out, being a role model, giving some direction, just helping out whenever I can. We all have bad days, we all have bad nights. I just reflect and know that every bad night I've ever had, we've gotten through it.
What I'm inspired about is that God is everywhere. From work to home, He's everywhere. When you're touching your patients, and it may be a difficult patient in the sense that the patient is very sick, I think that He is there to help guide us with our actions and in our touch with our patients. And at home, I turn to God every day for help, and inspiration to get through some of the challenges that we face every day.
That we reveal the healing presence of God through our compassion and empathy towards our patients. They're very frightened and they're vulnerable, so a touch of the hand, an offer of a prayer is so beneficial to them. I think I draw my inspiration from all the close calls I've had raising my children and seeing how God's mercy has been so abundant.
Even as my grandmother was older, she always said, don't worry about things you can't change, and just change the things that you can. So I draw from that pretty regularly.
I think the people around me that strive also for excellence and taking care of the children and doing the best job that we can do is an inspiration. I see it as a calling. Seeing people in need is an inspiration to me.
What inspires me is the work that I do. I love my job and all the challenges it brings. SSM is different than other healthcare organizations I've worked for. I found ideas are encouraged and welcomed here. It's not just a top-down type of attitude. We're called to be part of something bigger than ourselves. Our individual actions can really affect change here. I'm inspired that SSM lives out its mission, and it's not just words here.
I'm just, continually inspired by everybody that I work with every day, and I'm just happy to be with those people. It's the whole team, the whole staff, the whole administration, just everybody. We have to rely on each other so much that we just draw from each other, and every day I'm inspired by each and every one of them. I'm just taken back by all the care and the consideration that everybody has, and I think that's the mission that comes across, and I've been able to feel that.
I was a widow at a very young age. He was 24, and he had cancer, and the nurses, they helped me help him the way they treated him. It was just ever so inspiring. I looked up at them as if they were, like that was Nightingale herself. They just touched me because they touched him. You know what I mean? They were so gentle. That little bitty question, that little bitty thing can mean, can be paramount, can just mean so much. Just don't ignore the little things, because all those little things add up to the big picture.
And I don't know where my inspiration is going to come from each day. Sometimes it's from coworkers, sometimes it's from patients, and sometimes it's just walking in the door. My mom was a nurse here. She was an LPN at this hospital a long, long time ago. And she was the ultimate in patient-centered care. As I walk through the halls, every now and then I think about my mom, and I think about how she helped people simply by being of service to them.